In this talk, will be discussing some of the common sexually transmitted infections seen in the emergency department. This is a basic introduction, so you'll need to do some reading around the topic after you watch the video. At the end of the lecture, you will be able to discuss the differential diagnosis of penile and vaginal discharges as well as genital ulcers, describe the epidemiology, microbiology and clinical manifestations of gonorrhea, chlamydia, syphilis and herpes simplex. We will not be discussing HIV or PID, but these are topics you must know in some detail for your clinical practice and for your exams. So let's move on to the first case. A 26-year-old male patient who presents to the ED with a penile discharge and burning on urination. So I'd like you to pause the video and consider the questions listed below. Okay, so when we're thinking about penile and vaginal discharges, they can be sexually transmitted infections, other infections, or non-infectious causes. The sexually transmitted infections would include gonorrhea, chlamydia, and trichomonas. Whereas the other infections, which are not necessarily sexually transmitted, would include prostatitis, vaginitis, and some cases of PID, although most cases of PID are associated with sexually transmitted infections, candida, and then infections associated with instrumentation, for example, in older men with indwelling catheters. Non-infectious causes include smegma, which is of course a physiological secretion, irritation, for example, frequent douches used by women causing vaginal irritation, and some autoimmune conditions such as reactive arthritis associated with penile discharge or urethritis. Let's think a little bit about gonorrhea. So gonorrhea is a sexually transmitted disease which affects young adults and is reported more widely in males than females. Looking at the organism itself, it's a gram-negative intracellular diplococcus. The clinical features can be divided into primary infection, usually urethral or vaginal discharge and dysuria, which may then spread to adjacent organs, producing things like epididymitis, PID, and Bartholin's abscess, or maybe in sites distal from the genital organs, depending on the type of sexual intercourse that the patient had. If the primary infection is not treated, a few weeks later they may develop disseminated infection, which includes arthritis, particularly arthritis of large joints like the knee, tendinitis and synovitis, a rash which is often widespread and may be petechial, uveitis, and rarely meningitis and pericarditis. In the passage through the genital tract, neonates may pick up gonorrhea from their mothers, and this can cause serious neonatal infection such as ophthalmia neonatorum. The recommended treatment is ceftriaxone 500 mg iron stat. This is usually accompanied by clindamycin 100 mg twice daily for 7 days. The chlamydia is really to treat presumed chlamydial infection. And this is a picture of the intracellular gram-negative diplococcus in a urethral swab. So let's think a little bit about chlamydia. This is probably the most common sexually transmitted infection seen in the 18 to 34 age group. It's often asymptomatic and usually sexually transmitted, but can also be acquired through vertical transmission from mother to baby. It's an atypical obligate intracellular bacterium, and the clinical features, while often asymptomatic, if patients do have symptoms, it's usually associated with penile or vaginal discharge, urethritis, and in women dyspareunia. Again, the disease can spread to adjacent organs, producing things like epididymitis, cervicitis, or even PID. Vertical transmission through the genital tract can lead to neonatal infection, which can cause neonatal pneumonia, for example. As we said before, treatment is doxycycline 100 milligrams twice daily for 7 days. An alternative is 1 single dose of azithromycin. And here's a picture of the intracellular chlamydial organism. The second case is a 43-year-old male who presents with a painless ulcer on the penis, which has been there for the past week. Again, pause the video and see if you could answer the questions below. Okay, so as with discharge, genital ulceration can be either due to sexually transmitted infections, other infections, or non-infectious causes. The list above shows the common sexually transmitted infections causing ulcers. Just as an aside, you need to know a little bit about each of these infections for your exam. Some non-STI causes include Fournier's gangrene, cellulitis, and infected injuries to the penis or scrotum. Non-infectious causes include Behçet's syndrome, Stevens-Johnson syndrome, psoriasis, fixed rub eruptions, and malignancy, particularly squamous cell carcinoma, but also basal cell carcinoma. So syphilis is a disease whose prevalence is rising worldwide, and the Caribbean has the third highest prevalence in the world. It's often associated with men who have sex with men and is also linked to HIV infection. It's a spirochete, it's hard to grow in the lab, and therefore we often depend on serological tests for diagnosis. The non-treponemal tests such as BDRL are used as screening tests, and the treponemal tests as confirmatory tests. The clinical features of syphilis include primary, secondary, latent, and tertiary syphilis, and this is something you need to know in some detail, so you can pause the video and have a look at the symptoms for each of these stages of syphilis. Infection can occur through the placenta as well, leading to congenital syphilis in the newborn. Treatment is with a single dose of benzyl penicillin, 2.4 grams IM. In penicillin allergic patients, doxycycline can be used. And these are pictures of the syphilis organism, Treponema pallidum, dark field microscopy on the top, and immunofluorescence below. Finally, let's just talk a little bit about herpes simplex, an encapsulated double-stranded DNA virus, which is very common worldwide, causing both genital and non-genital infections. The symptoms are usually associated with painful, blistering rashes and ulcers on the affected area, sometimes associated with systemic symptoms. If caught early, this can be treated with antivirals. So that's all we have to say about sexually transmitted infections in this talk. If you have questions, you can bring them up in class. In summary, we looked at these conditions and presentations, and just to remind you, you need to do some reading on HIV, and PID as well. Thank you.